Welcome to Montgomery Heart and Wellness, and we have an interesting show tonight. Many people are diagnosed with congestive heart failure. So you may have a loved one, either you yourself or a loved one or someone you know was diagnosed with congestive heart failure. And then the next thing you hear is that you have to have a pacemaker defibrillator. And the question is, what's the reason for the defibrillator? I'm often approached by patients who come for a second opinion, and they're recommended to have a defibrillator. Now, oftentimes, there are patients who don't have congestive heart failure who are recommended to have a defibrillator. And this show is ideal for those individuals because we're going to talk about defibrillators and heart failure. Many individuals on our channel have asked us to discuss defibrillators. We'll talk about pacemakers a little bit, and perhaps on another show we'll exclusively talk about pacemakers. However, defibrillators are a very important tool that's been used in patients with heart failure. I'm going to explain exactly how they work, and so we're going to get into this topic of defibrillators and heart failure. So what are their benefits? And first and foremost, let's review heart failure because it's important to understand what heart failure is, the risk of heart failure, the risk how people die from heart failure, to understand the important role that defibrillators play in heart failure. So if you recall, we talked about two forms of heart failure: chronic condition that essentially where the body doesn't circulate blood commensurate to the body's need. There's systolic heart failure and diastolic heart failure. So essentially, if the heart is stiff, it doesn't fill adequately with volume, so volume is not circulated. If it's weak, it doesn't contract adequately, so volume is not circulated. So you have congestive heart failure with a weak heart, or you can have diastolic dysfunction with a stiff heart. Now, as you know, the heart has its own coronary system, and we all know about heart attacks. And so we think about the coronary arteries, the way the heart circulates blood to its own muscle as a means of nourishing heart muscle. So if you have a heart attack, one of these blood vessels can shut off. And many people don't know that the heart has its own electrical system. So the electrical circuitry of the heart is very important. It helps the heart beat and contract in an organized manner, in a controlled manner. So if you think about how the heart can malfunction, you think about the plumbing can go bad, so that can lead to a heart attack. It can also lead to slow, progressive dysfunction of oxygen delivery, so slow, progressive weakening of the heart due to what we would consider ischemia, or another way of thinking of ischemia is suffocation of the heart. Valvular disease. The heart's valves can become degenerated, can become worn out. They'll either leak or they don't open adequately. And so you have a situation where you have loose, leaky valves or stiff valves. So this can put extra stress, pressure overload on the heart, or volume overload that can make it weaker. And of course, you can have primary electrical problems that can lead to lots of arrhythmias, either atrial fibrillation or frequent ventricular arrhythmias that can also cause further damage to the heart, further predisposing it to electrical damage and therefore weakening of the heart. So how do patients with heart failure die? When you think about heart failure, you think, well, it's like the heart has stopped beating. That's really not the case. Heart failure, as I said before, is the inability of the heart muscle to circulate blood commensurate to the body's needs, or it's the inability to pump blood according to the needs of the body. So if you're climbing up a flight of stairs and you need to circulate 5 liters of blood, but the heart's only able to circulate 2 liters of blood, you're going to have shortness of breath. Your leg muscles won't get the oxygen and blood that it needs. The heart muscle itself won't get the oxygen and blood that it needs. So this could be a situation there. So, however, this is not necessarily the way you die. It's how you may have an impaired lifestyle. But the way people die from heart failure, there are two main ways in which you die from heart failure. One is pump failure. Pump failure is when the inability of the heart to circulate blood adequate to the body's need get progressively worse to the point where it affects other organs. So the circulation gets so poor, you have poor brain function. In many cases, you have poor kidney function. So the kidneys don't filter the acid from the blood. You may have poor liver function. Liver becomes congested, so it doesn't clear the blood from toxins. And so you have a toxic buildup and an acidic buildup in the blood. So the heart further becomes further more weak because of the inability to the body to clear the blood with these important organs. And so that's one important cause. But the other major cause is due to a life-threatening arrhythmia. Now, we may call this cardiac arrest due to ventricular tachycardia or ventricular fibrillation. This is progressive damage to the electrical circuitry of the heart that leads to more arrhythmia, to the point where you can have a sudden ventricular arrhythmia that shuts off the pumping of the heart muscle, that causes the heart circulation to shut down. Suddenly the person collapses, and if that heart is not shocked back into a normal rhythm, the person will die. So this is what we refer to as cardiac arrest, when you have a sudden onset of an electrical circuitry or short circuit of the heart electrical system. It results in ventricular arrhythmia or ventricular fibrillation. And because the heart's fibrillating, the more important chambers of the heart are fibrillating, then the heart ceases to circulate blood according to the needs. The brain doesn't get blood, the body collapses, the person goes unconscious. And if it doesn't get converted back to a normal rhythm, then you result in sudden death and the person doesn't recover. So this is the most common cause. And you may have seen in certain shows on TV where in emergency rooms, someone goes into cardiac arrest. The medical team rushes to the body. They have the paddles, and they put the paddles on the chest. And they shock the heart back into a normal rhythm. This is what they're treating, a sudden onset of ventricular fibrillation that you call 911. That's why there are AEDs that are in public places, and places like airports and schools. If someone goes into cardiac arrest, you put the AED on them, it'll detect the arrhythmia and shock the heart into normal rhythm. If you're able to catch them in time, then you can resuscitate the patient or the individual, help them recover to the point where there's not sufficient brain damage to where they can have a meaningful recovery. However, it's hard to do this when someone collapses in front of you. You may not have a defibrillator nearby. People become nervous. They don't know what to do. So individuals who are at increased risk of having this event occur can benefit from having a device that's already in place, and that's what we're going to talk about with defibrillators. So prolonging survival in heart failure patients is easy to imagine. Number one, you want to prevent or delay pump failure. We talk a lot about this in other videos. You want to make the heart stronger. You're going to do this with nutrition. You're going to remove toxic substances from your diet, from your lifestyle, reduce inflammation, reduce things that cause oxidative stress. You want to reduce or eliminate comorbid conditions. If you have high blood pressure, you want to control the blood pressure, diabetes, ischemic heart disease, or atherosclerosis. All of these things that can be reversed with lifestyle or other means should be reversed to help the heart function more effectively. If you have primary liver dysfunction due to some other cause, maybe you're consuming toxic medications or drugs, or you're smoking, you want to eliminate these habits. Alcohol, eliminate these habits. And of course, preventing or aborting sudden cardiac arrest. Obviously, it's important to have an AED around. If you have a loved one that has heart disease, being school or educated or trained in CPR is important. Having an AED, being familiar with that, is important. These are things that are community-based educational components that are important. And of course, implantable defibrillators in individuals who have the indication for the same. So what is an implantable cardioverter defibrillator? We call them ICDs for short. The device composition, you have what we call the battery and the pulse generator. This is more than just a battery. It has a battery in it, but it also has a computer in it. This is a very powerful computer that essentially can monitor your heart's rhythm. It can pace the heart. It can also charge and shock the heart and deliver a life-saving shock to the heart in the event that you need it. These devices can have one lead, or we call them single chamber. They can have two leads or dual chamber, have one lead in the upper and one lead in the lower chamber on the right. It can pace and sense in both of these chambers. So it may detect an atrial arrhythmia and differentiate from an atrial arrhythmia and ventricular arrhythmia if you have two leads here. And you have those that have three leads, one that goes to the left, well, of course, the right lower chamber and the right upper chamber. Then you put a left ventricular lead. It goes through a little vein called the coronary sinus, and we float it onto the left side of the heart on the outside, and it can pace the heart from the outside. So this is the basic configuration of the different kinds of defibrillators that you have. And here's the composition. You have the generator. Here's how it looks inside the patient's body. Single lead device goes through the vein here called the subclavian up to the SVC. And then into the lower chamber. Here's a dual chamber, as I showed before, and here's a biventricular or three catheter lead. This is used for heart patients with sort of special indications where you can synchronize the right ventricle. You can synchronize it. And this type of device here can actually help the heart beat stronger. So there's some extra benefits to the number of leads that you have. Here's an X-ray. You have the defibrillator here, and you have the lead going in here. Notice how you get a thickening in the lead here and a thickening here. These are what we call shocking coils. So this is where the high current shock is delivered between the device can and here, and sometimes between here and here. And there are different shock vectors we can program in the heart to give it the best chance of converting the heart from a ventricular arrhythmia to a normal rhythm. Here's a little fluoroscopy to show that how the heart's implanted, and you have the two lead. This is the atrial lead here. It may have fallen across the tricuspid valve. This is the ventricular lead that goes on, and this is actually what we see. So we're implanting the device, and the heart is moving at the same time while we're doing this. And here's how it may look once you have the device in. You may see a little outpouching here, a little scar. This individual has a shirt on. You wouldn't know that they have a defibrillator. And oftentimes individuals don't even have this little indentation. You just don't know what it is. So the device is very effective. How do they work? It's pretty simple. The most effective part of the device, or life-saving part of the device, is when it detects a ventricular arrhythmia. So the device, many individuals, I've had individuals I'll implant a device that I have for 10 or 15 years, nothing happens. I'll change the generator out, another several years, and next thing I know, I go and interrogate the device, and they may have had a sudden death episode in their sleep. It detected, shocked them out. Nobody knew anything different. They go, 6 months later, we say, oh, you had a cardiac arrest in your sleep 6 months ago or 9 months ago, whatever the case may be, and it saves their life. So a device only has to save your life once to make it meaningful. I recall one of my patients whom I had taken care of for, been working with rather for, I think it's 24 years now. Bad heart attack, major heart attack, and papillary muscle rupture, had heart failure. Once we worked him up and, of course, treated his heart condition, he ended up needing a defibrillator. We implanted a defibrillator, and he had gone through, I think, maybe 2 different generators. And one day, he and his wife were on vacation. He was driving, and I think they were on the road somewhere, and his wife noticed that he was just driving off the road and seemed like he was falling asleep. And before she can try to grab his shoulder, he suddenly woke up and got right back on the road. They drove, didn't think anything of it. A couple of months later, in my office, I'm interrogating the device. Oh, you had a cardiac arrest at such and such time. And they recount that time he had the cardiac arrest was essentially when he was on the road and nearly passed out, but the device detected it within seconds, shocked him back in normal rhythm. He woke up and drove. So it saved 2 lives in that situation. So essentially, the device here detects an arrhythmia. This sends a signal back to the computer. The computer counts it. We program it to count the beats, count the speed. And once it's confirmed that, yes, this is a life-threatening arrhythmia, it'll charge right here, and then within seconds, deliver a shock. And this happens less than 10 seconds, maybe less than 5 or 6 seconds in some cases. So it can detect and shock someone out of ventricular arrhythmia, before they can pass out fully, which is really key. So what are the indications? The newest indications, most individuals receive defibrillators because they have congestive heart failure, the ejection fraction less than or equal to 35%, and they have New York Heart Class 2 or 3 symptoms. It could be due to a heart attack, or either more than 40 days after a heart attack. We tend to give them some time to see if the heart can recover. And sometimes we may give it more than, say, 3 months. They wear a temporary life vest where we give the heart time to recover, see it can get stronger, either with nutrition, medications, or a combination of things, revascularization sometimes. But if the heart's due to less than 30% after a heart attack, for 40 days after a heart attack, you may want to implant one. LV dysfunction, if it's less than or equal to 40%, I may use 45%. And if I know someone's had a heart attack, they have an ejection fraction of 45%, I'll send them to the EP lab. If you can induce VT or VF, then that person will benefit from a defibrillator. And of course, if somebody passes out without unknown etiology, and you've done everything to work them up, monitor and the like, and you take them to the lab and you can induce a life-threatening arrhythmia, then you would implant a defibrillator with the consideration or likelihood that that cause of passing out was due to a potentially life-threatening arrhythmia. And of course, if you have sustained ventricular arrhythmia and somebody in structural heart disease, like somebody's had a heart attack, the heart's a little bit weak, or they have coronary disease, maybe the heart's not weak, maybe it's 50%, they have lots of ventricular arrhythmia, maybe the blood pressure drops or they get dizzy, then these individuals meet the criteria for defibrillator. Now, the other criteria, individual hypertrophic cardiomyopathy who have an indication for defibrillator implant. I was seeing a patient not too long ago, a young man with hypertrophic cardiomyopathy, and that's an excess of thickening of the heart muscle. It squeezes normally, but these individuals may be at risk of sudden death, especially if they have a family history of passing out, family member that died suddenly, or they have a personal history of passing out. These individuals will likely benefit from a defibrillator. So in that situation, this is your young individual. Yes, we're working to improve his cardiac condition, improve his overall health. But I told him on the other side, he's young, he has a young wife and young kids. Sudden death would be a major problem from his family standpoint. And so we recommend a defibrillator, even though we thought that we could probably improve his condition. And we do that sometimes with people with systolic heart failure. So it always depends on the circumstances. So what are the contraindications in situations where the cause of the ventricular arrhythmia is reversible? If someone has an electrolyte abnormality, or if it's in the setting of a heart attack and you see critical coronary lesions that can be revascularized with stent or bypass, then you bring that person back into an EP study. If you can induce a life-threatening arrhythmia, then they would not be a candidate for a defibrillator. Also, if the person's life expectancy, for whatever reason, they may have terminal cancer, or they may have severe heart failure to where they're in such bad pump failure, they're not a transplant candidate, and they're not expected to live beyond a year, they would not be a candidate. And if someone who's mentally incapacitated, maybe due to severe dementia, or they're very sick and not able to wake up and consent, that would be contraindicated in that individual. So what should you do? Let's say you're faced with this situation, you're diagnosed with systolic heart failure, and you're faced with a situation where you're diagnosed with whatever the condition is, but let's say systolic heart failure. What's your personal course of action? First and foremost, if your doctor say, look, you need a defibrillator, okay, accept that, get as much information as you can, but step back and look at your total health condition. Individuals who need defibrillators, they have other health problems. They oftentimes have diabetes, they have peripheral vascular disease, they have kidney problems, they have high blood pressure, they may be obese. So if you're in a situation where your health is so bad, someone like myself needs to implant a device, you may need to, take stock in your health and say, okay, I may need this device, but I need to take stock in my overall health. So first and foremost, focus on your total health. After that, you want to review the indications for the procedure for your health condition. Like I said, I had a young guy with hypertrophic cardiomyopathy. He was at risk for sudden death. And even though we thought we can get his health to a point we likely wouldn't need it, because he was so young, he has a young family, you only have to die suddenly once. The defibrillator don't have to shock you out of sudden death once to be worth its value of keeping it for however many years you need to keep it. And an implanted device, virtually all of my patients tolerate it very well. So review the indications for the procedure for your situation. Always consider potential risk and benefits to you, but also to individuals close to you. You may be young, you may be a business executive, you're the quote unquote breadwinner of the house. If you die in your sleep, okay, that's not going to be a problem for you. However, it may be a problem for your loved one, your kids, your wife. So think about people around you, people who are dependent. So that device could be helpful in that regard. And of course, always seek a second opinion. I have no problems when my patient want to seek a second opinion. If they're not comfortable with the recommendation I make, talk to someone else, get a different perspective. Don't use the person that I may recommend or whoever the cardiologist may recommend. Find someone else to get a second opinion. They have a different perspective on things. I've been in a situation where it's a difficult decision to make, and I may encourage a patient to get a second. Go talk to, any one of these other guys and get their perspective, because oftentimes a different perspective, and it doesn't necessarily mean that you will say go with the second opinion or not, but it gives you a different perspective from a different expert who can give you insight in terms of how to go about making that decision. So it gives you, and also at the end of the day, it will give you some comfort in knowing that you've exhausted all of the possibilities that you have. So hopefully that was helpful to you. And of course, if you're new to the channel, please subscribe, hit the thumbs up button, and like and share. Also, there's information in the description box down below. Many of you asked questions about how to use our philosophy in terms of nutrition and the like. Get my book, The Food Prescription for Better Health. I think it'll be very helpful to you. There's lots of information. I've had heart failure patients who follow the instructions of the book before even seeing me and get improvement in their function, as well as individual other chronic illnesses. So get the book. And of course, there's information in terms of how to reach out to us and the like. So I hope this is good. As usual, please leave your comments and questions in the information box. And of course, please leave ideas for future shows. We want to talk about what you want to hear about. So until next time.